What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, November 2nd, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. We keep learning new things about these viruses every single day, and they can really be a threat to your health. So you need to be informed with what is going on with each and every one of these viruses. That's where I come along. I give you a 15 to 20 minute video each and every day of what's going on with these viruses, with the latest news, data, case counts, and we do give an extra focus to COVID, but let's face it, there are other viruses that are up and coming, and you're going to hear about some of them today. So if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Alrighty, today will probably be somewhere around a 15-minute video. We do have some news to take a look at. We do have some data. We're going to take a look at those emergency department visits for people diagnosed with COVID. We're going to take a look at a wastewater site, maybe two, and a couple other things. Starting off in Germany today, the number of sick days taken in Germany has gone up sharply since the start of the pandemic. Take a look at this. You can clearly see it here, and we don't even need to click on why. Long COVID and maybe a couple other things is the main reason why. And they show per person, per man, per woman. And look at per person. It's almost up near 20 per year. Yeah, almost up near 20. That is pretty significant. And then when you talk about in women, it is above 20. And per man, it is slightly less, in between 15 and 20, maybe around 17 or 18. So that is pretty significant, if you ask me. Then we come over to this. This is bad news. This BNO tweeted this out yesterday. It's been confirmed by many sources. New. U.S. reports 7 more human cases of H5N1 bird flu, including 3 in California and 3 in Washington. I know. More cases. Are we really going to do this? Continuously having more cases without addressing the fact that, hey, this is starting to happen more frequent, and hey, why we keep saying, oh, well, the risk to the public is low. We're watching the number of cases go up. We just also learned this week that H5N1 has been found for the first time in pigs, so this is really starting to get concerning. And while there have been no reported deaths in humans yet here in the United States, we can't allow this to keep happening because there was a story yesterday that I shared about people traveling from Washington down to Oregon who are infected with H5N1. I mean, the recipe's there, the ingredients is there. I mean, look at COVID. Now that we're in 2024, people are not taking viruses serious. And should this go widespread, people are not going to take this serious. They're going to take it as a joke. And it's really going to take off because we cannot do precautions well. We never did do precautions. Well, we did slightly at the beginning of the pandemic, but by the time we got into the middle of 2021, 2022, it was basically a free-for-all. And now, as we see with the COVID virus, there are people disabled, there are still people dying, there are still cases, all these problems. And now we're starting to see other viruses just go on a free-for-all as well. We can only hope H5N1 does not do that because there are a lot of questions. There's nobody vaccinated for it, and it could be a big problem down the line. But once again, gotta mention, no deaths so far, but should we allow this to go widespread? That could change. Alright, taking a look now at this. This is some good news. City of Boston offering free flu and COVID vaccine clinics. So if you're up in that area, you can go get your, if you want to, you can get your flu shot. You can also get your COVID booster shot. Taking a look at this, speaking of long COVID a few moments ago, take a look at this. Nearly 10,000 long COVID patients in the Netherlands are unable to work. I have mentioned this before. One case of COVID can destroy your life. And for the most part, one case of COVID was what changed my life. That's for darn well sure. And there are so many people that have it much worse than me. There are people that have had to quit their jobs, lose their homes. Yeah, long COVID can totally disrupt your life, and it can destroy your life. What's the best way to avoid long COVID? Simply do this. Wear a mask, not get infected with COVID, and guess what? If you avoid a COVID infection, your chances of long COVID are really low because you would not have been infected. But here's the other problem. If you do get COVID and then get it again, for each COVID infection you get, guess what? Your chances of getting long COVID go up. And if you already have long COVID and do get infected again, long COVID could get worse for you. Some people get lucky and don't get it at all. Others go on to get long COVID, and it really impacts people's ability to do day-to-day activities because long COVID is such a severe illness. Whooping cough in Alabama, cases have nearly tripled this year. Yes, whooping cough, otherwise known as pertussis, is up once again. 124 cases versus 41 just last year. And if you think it's just Alabama, wrong. Maine also came out with these numbers. According to the Maine Centers for Disease Control, there have been 101 reported cases this year, up from 76 in all of 2023, and we're not even done with this year yet. Wow, that's not good. All right, let's take a look at pollen levels. There you go. Green for much of the country, just some yellow in southern New Mexico and portions of Texas, which means we are going to eventually probably put this in hibernation until spring, and I think I'm going to be doing that next week. You won't see me showing the pollen map for a while. Let's take a look at air qualities just real quickly. There are a few areas of concern, at least last I checked there were, and that was the West Coast. Yeah, we can see here. Oh yeah, wow, now there's far more yellow than there was this morning. So a lot of yellow, some oranges mixed in on the West Coast. Chicago area, some yellow for you, some yellow ahead of that system. In Texas, you get the idea. There's a lot of places where you should be concerned about air qualities. Nothing terrible in the Northeast yet. Just a few sites that are, for whatever reason, showing some high numbers. That could likely be wrong. Better air quality today in North Jersey and Connecticut. There was a wildfire in North Jersey yesterday. As long as it's dry and it's windy, it's going to be remaining a threat. Taking a look at this. Yes, my other place on X where I talk about weather. It is Climate Data Report, and we just posted on my other YouTube channel, which is also Climate Data Report. I talked about several things today in that video. A tropical system is likely to enter the Gulf of Mexico. That's the name of the video, but I also talk about flash flooding and severe weather threat that is up for portions of the plains, and the death toll from the Spain flooding did go up higher. Want to learn more about all that? Go check out that video on my other channel. Philadelphia yesterday. Not happy about this one. 850 EMS incidents. Let's do a live look in with Montgomery and Chester counties, and I'm going to refresh this just to make sure it is up to date. And we can see here there are some calls to be had right now. Not terribly busy. Just 10 calls. If it was really busy, well, we'd be closer to 20 or over 20, so we can deal with just 10 calls right now there. But somewhere where is, again, actually, no, Chester County is not all that busy as well, but I do see this one, Honeybrook Township, cardiac arrest. That's not a good call. It looks busier than it is because there's a lot of EMS standbys just for them. That could be a sporting event or some sort of an event where ambulances need to be on standby in case there should be a medical emergency. It could be at various different things. And then we do see a few heart problem calls and a couple other things. Alrighty, taking a look at the viral activity level in Canada, it is low for COVID, low for flu A, not detected for flu B. RSV is moderate at this time. Alright, let's take a look at Walgreens. Walgreens this week, the positivity rate, it went down, but it didn't go down by much, 0.3%. 15.9% positivity rate reported this week. Now taking a look at some data provided to us from CJS A3172. But before we do this, I have to remind you of something. It is football weekend here in my state of Pennsylvania, up at State College, Pennsylvania. There is a huge super spreader going on there for all these viruses. 110,000 people potentially within the football stadium, Beaver Stadium, plus thousands upon thousands of people that did not get into that game today. Yes, this could potentially be a super spreader for COVID, RSV, flu, and anything else that could be running around in that area. And people come from all over to the one centralized area, and then they go back to where they came from. Plus, it could also be a super spreader among Penn State University itself, so it's something we do need to be concerned about. Now for that data from CJS 83172. Florida, 525 new cases reported, and 18 new deaths reported yesterday, and 1,927 cases, and 138 deaths reported this week, a substantial amount of which were from July. New Jersey, 247 new cases, and 3 new deaths reported yesterday, and 1,841 cases and 11 deaths reported this week. I can tell you, for whatever reason, on New Jersey's dashboard, we did not get an update on hospitalizations today. I thought it was mandated that they're supposed to do it now, but what do I know? New York State, 681 new cases reported yesterday, 4,134 over the last 7 days, to go along with 34 new deaths. Puerto Rico, 148 new cases and 1 new death yesterday, and 752 cases and 3 deaths reported over the past 7 days. Weekly reporting states: Alabama, Missouri, 9 CDC reported deaths. California, 2,176 new positive tests and 78 new deaths. And I can also report, we saw it in their dashboard yesterday, the positivity rate did go up ever so slightly for COVID in California last week. Idaho, 303 new emergency department visits. Illinois, 26 new deaths reported in the past week. Louisiana reports 764 new cases and 16 new deaths, which include 12 deaths reported by the CDC in October, since the LA, Louisiana Health Department hasn't yet begun COVID death reporting for the 2024-2025 viral season. Montana, 316 new cases and 2 CDC reported deaths. Pennsylvania, 46 new deaths, including 1 from May and 1 from August. South Carolina, 10 CDC reported deaths. Wisconsin, 562 new positive tests, a test case positivity rate of 6.3%, and 12 CDC reported deaths. West Virginia, 686 new positive tests and 6 CDC reported deaths. So thank you, CJS 83172, for providing us with that information. Now let's take a look at a wastewater site, maybe 2 wastewater sites. And Newark, New Jersey, since we cannot see the hospitalizations, what's going on in wastewater there today? We haven't checked here in quite some time. We can see COVID is still listed at low at this time. It's not really rising yet, but RSV at this time is starting to rise, and influenza A is seeing just a slight rise. Both that and RSV are still relatively low once again. Still, that's good news. Influenza B is low, HMPV is low, and norovirus at this site is also listed as low. Taking a look at what's going on with Mpox, and we can see the Clade 2 strain, there were some detections back in October. Now let's go out to the west just a little bit further. How about we see what's going on in Harrison, Arkansas? And we do note that at this time, medium levels for COVID, still dropping, that's good. RSV is low at this time, influenza A, influenza B, HMPV low, and wow, when this wastewater site does norovirus, they really do it up big. Last year, or was it early this year, they had a huge rise for norovirus. Once again, really high levels of norovirus. Truly concerning. At one point, it was up to, wow, almost 140,000 pathogens detected. I don't know how accurate it is. You do see there is a wonky movement here, and that does seem a little bit high. Either way, it is still very high levels of norovirus. No detections of Mpox at this time. Alright, let's take a look at the latest variant of COVID, which is the KP 3.1.1 variant, which is in the lead at this time at 57%. XEC, which is looking to become the next dominating variant for COVID, is at 17%. Alright, let's take a look at those emergency department visits for all the states that are listed around the United States. There's some that you will see no data for. United States overall is dropping. Again, these are people diagnosed with COVID. showing up at the emergency department. Alabama is still dropping at this time. Alaska is starting to rise a little bit at this time, as is Arizona and Arkansas, though there may be a little bit of a drop once again in Arkansas. California is dropping at this time. Colorado is seeing a slight rise at this time. Connecticut still dropping. Delaware, the drop has stalled. You're not really dropping all that much anymore. Washington, D.C. also is starting to see a slight rise. Florida is still dropping. Georgia was starting to rise. Now it's leveled off once again. Guam is not really doing much more than bouncing off the bottom. Hawaii is seeing just an ever so slight rise at this point. Kind of concerning considering they were one of the hardest hit areas in the summertime, but you can see here, there are some notches along the way while they were going down, so they could rise slightly and then go back down. We'll keep an eye on it. Idaho continues to drop at this time. Illinois has completely stalled. Doesn't look to be dropping anymore. It's not rising yet, but it's also not dropping. Indiana, similar deal for you, your neighboring state. Iowa is still dropping at this time. Kansas is still dropping as well. Kentucky also looks to have stalled. Louisiana has not only stalled, slight sign of a rise there. Maine is still dropping. Maryland has stalled to ever so slightly still dropping. Massachusetts is still dropping, just not as fast. Michigan has stalled at this time. Mississippi has not only stalled and is starting to rise again. Montana is still dropping. Nebraska was stalled, was starting to rise, now is starting to drop once again. Nevada has stalled, and New Hampshire is still dropping. New Jersey is starting to stall. New Mexico stalled, and then it started to drop once again. New York is still dropping. North Carolina is still dropping at this time. North Dakota is still dropping, and it looks like Ohio has stalled, and who knows, they may rise soon, because we saw the dashboard for Ohio, which showed their cases were up just a tad, as was hospitalizations, if I remember correctly. Oregon, still dropping at this time. Pennsylvania is still dropping, but it's slower. And there are a lot of big events. I talked about Penn State University. There's also going to be a football game in Southeast Pennsylvania. I don't know. Is the Pittsburgh game in Pittsburgh this weekend? Or is this their bye week? I don't know. I haven't followed that one. Then there's also going to be a big concert in Philadelphia and concert in Pittsburgh, I'm hearing now too, which is in relation to the election. All these big events are super spread. That could be what stalls us all together, because people are going to come from all over for these various different events. Rhode Island is still dropping at this time. South Carolina, if I had to take a look at this list, can we look at this closer? No, we can't. And now I've really gone and done it. Anyhow, South Carolina looks like they are stalling at this time. South Dakota, also stalling. Tennessee is stalling. May even be starting to rise again soon. Same deal with Texas. Wow. And this is early for Texas. Texas usually doesn't start its rise until a few more weeks closer towards Thanksgiving. Utah is still dropping at this time. Vermont is still dropping, as is Virginia, Washington, West Virginia, Wisconsin. And look at this. Wyoming at this time is relatively flat. Now, we did not get to show you anything for Wyoming or Missouri. Let's see if we can do anything for wastewater, at least in Missouri, and we can. And we'll do a full wastewater update tomorrow. Taking a look around St. Charles, it is still dropping at this time. St. Louis is still dropping. That's good news. And take a look here. Another St. Louis, still dropping at this time. And let's make our way up towards the northwest, and we'll take a look at Wyoming. You can see here, Wyoming, looks like you are still dropping at this time. We might as well take a look at your neighbor, Montana, because I clicked on it. And Montana is 8,700. Population at Park County, just an ever so slight rise at this time. And of course, we'll take a look at far more wastewater sites again tomorrow. Hey, look at that. This video went longer than expected. If you enjoyed this video, give it a thumbs up. Subscribe down below if you're new. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I will see you all again next time, which will be for tomorrow on Wastewater Sunday. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.